the topic is when should doctors retire? At what point should they hang it up? And it's pretty interesting because we do jobs that require for sure mental acuity and then also manual dexterity, if depending on the type of doctor you are.
Yeah.
Like
isn't there like a log into like ageism issues too?
There are. I mean, ageism. I mean, there is absolutely laws against ageism. Like, you can't discriminate against hiring someone because of their age.
Yes.
But this is more like, for people who are maybe into the retirement ages. And the reason I bring this topic up, of course, I always pull up topics based on news articles. So there's an article a couple weeks ago about a New Hampshire plastic surgeon, Dr. Lawrence Gray. Apparently he's had a very successful practice, for many years. He started his practice initially in 1985.
Yeah.
Which I calculated out, that puts him at around 73, roughly, 73 years old, which to me is pretty old for a surgeon. I mean, I've seen surgeons that are 70, but 73 is pushing it.
Yeah, that's
so
up there.
he actually, unfortunately, and I'm not at all trying to beat this guy up. I'm just kind of reporting what I read. So apparently Dr. Gray got suspended by the state board. Sometimes I get really upset with doctors. Like, there was the one, that was last week that we were talking about, the one out in Washington.
Oh, the pretend Florida lady that moved to Washington.
Yeah. So sometimes I really am like, but this guy, I mean, apparently had a really, really good career. But unfortunately, he was suspended by the state medical board. He was reported to have 15 to 20 surgical errors, like in the past year or two, including one wrong site. So wrong site means that I meant to operate on the right breast or leg or whatever, and I operated on the left. So that's like a really big thing, mostly in like orthopedic surgeries.
Oopsie.
Yeah, it's a big oopsie. Like it's something we talk about a lot in like orthopedic surgeries, because you might be having like a right knee replacement, but then they actually do it on the left. That does happen from time to time. It's called in surgery we call it a wrong. Like, it's a wrong site. So he had a wrong site, which is not a good thing. But then also there were multiple reports from patients of the fact that his hands would shake. That there was in fact 2 people that talked about how when they went to get their marks for surgery, that like he couldn't mark them because his hands were shaking. Oh wow. And I was like, holy crap, like that's pretty legit. Like, that's a legit complaint. I mean, if you're a surgeon, even plastic surgery, which, I mean, you think about something like a heart surgeon, like obviously their hands have to be like ice. Neurosurgeons like ice. I mean, plastic surgeons, like, it's not as if your hand was shaking, you're going to poke the heart and the person dies. But still, you're doing surgery. You need to have steady hands. Yeah. And so I guess he had gotten a bunch of complaints against him for these various reasons, and the medical board actually suspended his license. And I'm not at all like trying to beat this guy up. I think that based on his age, he probably is just getting up to the age where, you start to have these issues. And so it brings up a very interesting, question, because as of right now, there's not really any type of restriction on when doctors are forced to retire or have to give up their license.
Yeah.
And it's kind of unusual, right? Because you think about pilots. Did you know that there is a maximum age for pilots? It's 65 years old. If you hit 65, if you're a pilot, you cannot be like I guess they call him the commander, or like the head pilot. Like, you can take a lesser job, like you could maybe be like the radio officer or whatever, but you cannot be like the head pilot anymore after the age of 65. And I mean, honestly, like, I mean, on the one side, you're like, well, I know a lot of 65-year-olds that are very mentally sharp and are probably have better dexterity than I do. But then again, a lot of times that when people get up to that age, they do start to have issues. So I don't necessarily have an issue with that from the pilot standpoint. And so, I mean, what do you guys think? Like, what do you think about having an older doctor? Or what age is too old?
Yeah, that's a fine line, because it's like you want somebody with a lot of experience.
You do, right?
But then you don't want somebody that's shaking their hands while they're trying to mark.
How you doing?
Was it your right side or your left?
Yeah, it is a fine line. And I'll tell you, at this point, I don't really want like a super young doctor.
Yeah, you want somebody with experience.
Yeah. You want somebody with experience, because I'll tell you, like, your first years out of training, out of residency, when you're on your own, they are different than when they are now. I mean, I remember in my first year...
You're just not as confident.
You're not as confident. You haven't done as many of the procedures, and especially on your own. When you're in residency, you always have somebody hovering about you to potentially fix your problems. When you go out on your own the first time, I mean, you're on your own. And maybe you have a partner or something. I was totally solo, so I had nobody to fall back on. And like, before surgeries, I was like reading up and watching videos, just even though I'd done them before, just to make sure. And of course, now I don't do that. I mean, I've done these things so many times.
Yeah.
So you don't want a young surgeon, but on the other hand, do you want a really old surgeon? Travis, what's too old for a doctor?
So I don't know.
I'm not gonna hold it to you.
For sure. I don't know what's too old for a doctor. I think like once you start around like 65, 66, you should start looking at maybe like retiring, just because like your health is kind of like in question, I guess. At that point, like especially if you don't have a steady hand. Like if you don't have a steady hand as someone cutting on people, operating on people, you should probably.
So and that comes to my next point is I do think that if you were going to mandate some sort of like assessment or even mandatory retirement, I do think it depends on specialty. I mean, obviously, in my opinion, surgeons should be held to a higher standard than maybe a radiologist who is sitting in a chair and looking at x-rays. Not that their job is not important, but you don't have to have a steady hand to look at a TV screen and dictate what you see.
Yeah.
Even if you evolve your position, like if you love the field so much that you
you can like become like a consultant
like a
and like hire, and then
right.
you can be like the big dog and hire out.
And we're usually not this close. We're like bumping into each other.
And you can hire out like the surgeon, and you can hire your own surgery staff, but you can still be the consultant and still recommend things.
Right.
Yeah, I think about that myself. I mean, it's funny. I never thought I would maybe be doing surgery my whole life. It's not that I don't like it. It's just that I get bored. I want to do something different, like be a talk show host or something else. I don't know.
You're gonna have your med spa.
Right. So I'm open a med spa. So that's something like I might do when I retire. It's like run the med spa and just be there and hang out and talk about with skin treatments. But it is a good question, and as of right now, which this may sound scary, there really is no regulation. Unless a doctor sees another doctor that they think is putting people in danger, I mean, to my knowledge, there's not a point where the medical board says, sorry, we're not going to renew your license.
Well, it's just that they have so much responsibility with people.
Oh, absolutely.
Like you're completely in their hands.
Yeah, so you have to be mentally sharp, and then if it's a procedure doctor, they have to have that steady hand.
Well, this same issue has popped up for politics, but we don't need to get into politics.
Oh, right. Yeah. I mean, I agree with that too.
What's the age when a politician needs to retire?
Well, you think about Ronald Reagan, who is one of the most beloved presidents ever, and towards you guys probably don't remember, but towards the end of his career as president, people were questioning, like, is he there? And then it came out that he did have Alzheimer's.
Yeah.
And even with Joe Biden, like the current
that's why it's coming
up.
I mean,
I don't like to talk politics, but I look at him like, geez, man, like, I'm not sure I want him having the nuclear button. I'm not sure I want anyone having the nuclear button, but I want somebody that's like sharp.
And
you know what I'm saying?
And that was the thing with like Bernie, like that's a real like conversation that you kind of have to have about like people in like high-ranking positions. Like, if you are a certain age, are you still capable of doing that job?
I think the one thing I would say about politicians over surgeons, not to say that one's more important than the other, but I feel like if you're the president, you have like that whole like layers of like oversight on you.
Mm-hmm.
Like your surgeon is like a one-man island, more or less.
Yeah.
Like when they're operating on you, because
you're supposed to be the specialist. If you're a surgeon, you are
because it's not like
specialist in that.
I guess if you were really doing something just insane, a nurse might say, look, we need to stop, or like call in somebody. It was like, remember when we talked about the doctor that was doing the surgery in their office and the patient went into cardiac arrest, and they were like, we need to call 911, and the doctor said no.
Yeah.
I mean, obviously that's like a huge thing where the patient's in cardiac arrest, everyone knows that something's going wrong. Surgery can be much more subtle. It could be something like bleeding starts on the inside, and the nurse doesn't know if that bleeding is normal or not, And so I feel like that, surgeons especially have a lot more potential for harm. Although I guess for politicians, if they end up causing a war, that would cause a lot more problems.
Yeah.
But there's a lot of oversight in politics, right? I don't know that there's that much oversight when it comes to doctors.
Yeah.
Well, I feel like you only have so much time to complete a surgery before it starts becoming like life-threatening, I'm sure.
Yeah. Yeah, it's funny you mentioning that, especially like with some of the newer people coming out, like that does come into question. Like newer people take a lot of time with surgeries. And every once in a while, I've been around for a long time now, so like new surgeons have come and gone, and like someone new will come like, oh my god, it took them X amount of hours to do something. Like, geez, that should take like
really
30 minutes.
Cutting it, yeah.
Yeah, but then I guess as you get to that other end of the spectrum, then maybe bad things start happening too.
Sure.
Yeah.
But for different reasons. I think early on it's like inexperience, and then as you get older, then it's purely just skill level starts to
just
dissipate.
like watching my mom, like she retired when she was supposed to retire. She's a nurse. She retired when she was supposed to, like around, late 60s.
Yeah.
But it's like she stopped working in a hospital. She was more like department.
Well, I give you
area.
guys full authorization. Like, if we're still doing this show in like
If I start
15
seeing your
years,
hand shaking,
and
I'm
you
gonna
see
go
me
to your
start
office
slipping,
and be like,
you can like tell me it's time to hang it up.
No.
I'll go find something else.
it's time for Dr.
You're
Bruce
done, man.
to-
You're out. I feel like I'm pretty steady right now, though.
Yeah. He's fine. Everything's fine.
Oh my gosh. All right. Well, good topic. I think it's interesting. As I said, there's not a lot of regulation right now. I do think that there are some fantastic doctors in their 60s, so I'm not at all like trying to say everyone needs to retire super early, but it is something we're talking about, especially since that we had this episode in the news where it became a real issue. So
Yeah.
but let me know what you think. If you like an older doctor, younger doctor, leave us a comment. I want to hear what you think.